Oh, are you getting pain shooting into your back or shooting down your leg? Stiffness, tightness? You don't need 30 minutes of work to get relief. Just follow these next couple of moves and we'll have you feeling better right away. Hey, I'm Dr. Erickson, your herniated disc expert. Follow these moves to quickly get the pain up and out of the leg and restore your function so you can get back to all the things that you enjoy. Okay, if you have trouble with pain when sitting, when bending, and you generally feel a little better when you're up, moving around, walking around, you're likely showing some directional preference into extension. So start prone on your stomach, on your elbows like this, and just kind of feel what happens in that leg as you're just on your stomach, maybe prop on the elbows a little bit. Start here for about 30 seconds. If pain starts to increase in the lower back, but it's coming out of the leg, stay here as long as you can. Just make sure it's tolerable. And then you can always come back flat again. If it starts to get a little bit too painful, come back flat. Let things calm a little bit. And then slowly progress this into bringing your hands down under your shoulders, hips and stomach totally relaxed. Lightly press the chest and shoulders up as high as you can. High, 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 ouch, 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 and then come back down. I know you're going to feel it pinch in the lower back. It's fine as long as when you come back down, it calms down. For example, I have a 5 out of 10 pain in my left lower back. I press up, 6, 7, 7.5, 8, that hurts, come back down, back to 5. It's not wrong to increase that pain back there, or even into the leg a little bit, as long as when you stop, it resolves fairly quickly. It just can't progressively move down the leg and stay. That would be wrong. So start there, prone on elbows, then down to some light extension and lying. All right, so we're going to go with about a minute of each one of those. So, I said let's start with 30 seconds, kind of build up to about a minute. You can always come back flat if you need to, and then just back and forth from this position, and then we'll slowly work into those extensions. By the time you get about 12 to 15 reps going slowly, that'll be about another minute or so. And then from here, I'm going to roll over, and now I'm going to specifically work on the leg that's giving me a little bit of pain. In this case, let's make it the right side right here. And I'm going to lightly just glide that nerve root through there. Now, the common mistake that a lot of you will make and a lot of you see is you'll try to actually stretch the hamstring, which is a mistake. I know you feel it there, but the problem is not in the hamstring. It's not your muscle. It's not tight. It's just the nerve root that's making you feel the tightness and the pulling, the straining sensation in there. So we're not going to stretch that already. We don't want to statically stretch that already irritated nerve root. I want to just lightly put a little bit of tension on it and then let it go. So we're going to lightly glide that nerve root, and then what we'll do is we'll go the other side, and let's do a minute of that. This side now won't feel the same. It'll feel fairly benign. It won't really, maybe just a light stretch. It won't hurt, but we want to go back and forth about a minute of nerve glides. And then the key is, what we started with on your stomach, we're trying to actually move that piece of tissue, that offending piece of disc tissue that's bothering the nerve root. We're trying to manipulate or kind of milk that piece of tissue out of the way so that it takes the pressure off the nerve root. So you can kind of come back and forth between those two positions. All right, so a minute of those. Then I'm going to climb back onto my hands and knees. And from here, I'm going to work a little bit more of that extension. So by letting the hips kind of sag down. So this will be kind of that, people like a cat-cow or a cat-camel type movement. We can get a little bit of flexion. Now this is going to test it a little bit. As you bring the stomach in and arch and round the back, if it starts to bother you into the leg, come right out of it. So you can touch the edge of it and then come right out of it and try to sag again into that extension and then come right back into it. So we'll do a minute of this cat-cow movement. And then from there, since we're already in a quadruped or hands and knees position, now let's add a little bit of strengthening. Okay, first we have to I'm going to give a little caveat to that. First, we have to make sure that we're getting the pain reduced in the leg really before we start a lot of strengthening, because you can't strengthen the disc back into place. It's not a muscle. It's not a tendon. It doesn't respond always to strengthening movements. But in this case, I'm going to show you this one. Let's just say things are kind of calmed down in the leg now. I'm going to keep myself in a neutral position, not too much curve, not too much sag, kind of in the middle. And then I want to use opposite arm and leg to get a little bit of light strengthening here And what I like about this one is that as I kick that leg back, I get some hip extension, which is slight extension for the low back, mostly hip, but you got to use the glute muscle a little bit. And we get a little bit of lumbar extension through there, lumbar and hip, okay? So we'll do a minute of the alternating bird dog exercise from what I would call it. We'll be a bird dog, okay? That would be next. Okay, then the last one, bird dog. Okay, on to the hip. Okay, then from this position, then I'm going to go to kneeling to try to put myself in a little bit of a advantageous position again. Slight extension through the low back, slight extension through the hip. I'm going to lightly glide my hips forward, pressure on, pressure off, pressure on, pressure off. Again, I'm getting some hip extension. I'm getting some lumbar extension because we spend a lot of our day in sitting, which puts our hips in flexion like this. So I want to stretch, get a little bit of lengthening in the front of that hip. And by default, I get a little bit of lumbar extension because I'm staying tall through here, not coming this way. My chest stays high. I'm just moving my hips forward. Pressure on, pressure off. Okay? Let's get a minute of those on each side. And then at the very end, I like to go back to prone and end with the extensions one more time. Pressure on, pressure off, another minute. And that should take you about, somewhere between 8, 9, 10 minutes. You don't need a full, 30-minute workout or anything like that. But the key is you can't just do this one time per day. You need to be working into these directions when you've already noticed that you have a directional preference or you have a intolerance to bending and flexing and sitting. This needs to be done, especially the ones that you find are bringing the pain up the leg, whether it's the prone on your stomach or elbows, whether it's the press up, whether it's the cat-cow, whether it's the hip extension, whatever is bringing that pain up the leg multiple times a day. So you're shooting for 60, 70, 80 reps per day, but space it out, okay? But in no time, in just a couple minutes at a time, over the course of a couple days, you should be able to get some quick and lasting relief of that pain in the leg. All right, there's an example of a very effective yet quick routine that you can go through multiple times a day to get and keep that pain up and out of the leg. Now, if you want a more structured plan, something where I can help you and guide you day in and day out, and as things change, because you've noticed this, that they do change throughout the day and throughout the week, let me know, comment better, like, download, subscribe to all the channels, comment better in the section, and check out my website, theherniatediscfix.com, for more programs, and we can get you on the right program that'll help you fully maximize and fully return back to safe lifting, fitness, anything that you enjoy.